speaking on accuracy.
Good morning. In this topic, I first talk about the animal experience and then about human studies. And so now I'm nervous because this is my first time for English oral presentation. I'll do my best. 3 years ago, when we began our research, the threshold limits value by ACGIH for 222 was 22 millijoule. But however, these threshold values were determined based on the old research, maybe more than 40 years ago. How much irradiation is safe for the eye? Let me talk about the human eye. The surface of the body, especially face, is the area most exposed to UV. The lights that come in front of the outside pass through the cornea and pupil and the lens and vitreous body to the retina. However, the absorption efficiency is UV varies depend on the ocular tissues, such as the cornea, lens, and vitreous body. And next is photoprotective mechanisms of the eye. One is the avoidance response. When shiny, we close our eyes or turn away our face. The second is the iris. In dark areas, mydriasis increased light transmission. And in light areas, contraction of the iris adjusts the size of the pupil, reducing the amount of light. In general, the iris of blacks or Asian has a more melanin pigments and its more effective role in blocking light. And the crystal lens is clear at birth, but become cloudy and less light transmissive with age. The lens gradually turns yellow and then become brown. It's cataract. So advanced cataracts absorb blue light well and are said to be associated with insomnia or depression. Maybe some of you have cataracts and some of you may have had cataract surgery. I often perform cataract surgery and I use IOA intraocular lens that absorb UV light. And this is a human eye. Central corneal thickness here is about 500 to 550 micrometers. Light entering here and go through the pupil and lens to the retina. So cornea, lens, and vitreous body basically allow visible light to pass, but some UV rays are blocked by the various tissues. The past reports have generally shown like this. The UVC wavelengths are mostly absorbed by the cornea. The wavelengths of around 400 nanometers, a half amount of light penetrate cornea. But UV is further absorbed by the lens. It is said that only a very small amount of UV reaches to inside the eye. So irradiation was first performed on rats. Here is a rat's eye. The wavelengths were 311, 254, 235, 222, and 207, and exposure is as follows. This is a tissue at 24 hours later after irradiation. Most of the tissue looks normal, but the red frame, the epithelium cell loss is observed, and in 254 nanometers, so 100 or 300 millijoule, and But in 222 group, the 2,500 measure is not problem. And CPD is a method for measuring UV damage, and CPD showed strong staining at red flame. At 235 and 254, the corneal epithelium cell is damaged even at a low irradiation dose. But 222 and 207 nanometers group, a high irradiation dose are required to damage the epithelium. However, the cornea repairs quickly, so the injury may be gone after 24 hours. So we examined immediately after irradiation. The results showed that only the superficial layer of the corneal epithelium was injured by irradiation at 207 and 222 group, very topmost layers. The 254 and 311 nanometer groups showed the deeper damage to the corneal epithelium. We found that the depths are quite different depending on the wavelengths. This is true not only rats, but also other animals. CPD shows 222 UVC confined to the very superficial layers of the cornea. So even 222 UVC does not perfect. Why is the CPD gone after 24 hours? This can be seen in the time course after irradiation. The damaged corneal epithelium cells gradually drop out by apoptosis due to corneal turnover and disappear in about 12 hours in 22 groups. This suggests that damage may not remain in the cornea in the 222. In addition, the new corneal epithelial cell generated in the corneal limbus around here. This area is deep and it's not likely to be injured by 222. So Far-UVC, such as 207 and 222, did not reach to the stem cell of the corneal limbal epithelium. For corneal repair, there is an XYZ hypothesis. Corneal epithelial stem cells are located at the base of the limbus and have a high proliferative capacity, and they divide actively to provide a new cells X and move to the center Y. When the cell reaches the surface, they undergo apoptosis and drop out of the surface of the layer. It's a balance. If this balance is upset, corneal injury can be prolonged. In fact, Yamano's group said continuously irradiated rats at 222 and 254 and found that corneal scar was generated at the only 254 groups. If the injury is prolonged in this way, a disease such as pterygium or skin cancer may be occurred in humans. In summary, the 222 and 207 UVC cause damage only the topmost layer of the cornea and have low depths, suggesting that these wavelengths have very low injurious effect to the eye. Corneal epithelium cells in the superficial layer of the cornea are quickly repaired by turnover, so corneal damage is unlikely to occur. Then, human cornea has 3 major layers: epithelium and stroma and endothelium layers. And the thickness of the epithelium is about only 50 micrometers, it's 10% of the corneal thickness. The epithelium consists of 4 or 5 layers of the epithelial cell in the center and 10 layers in the periphery. The corneal endothelium is a single layer of cells that covers the posterior cornea, is organized in a characteristic honeycomb pattern like this. So human corneal epithelium cells are primarily responsible for regulating stromal hydration. Physically, human corneal endothelium cells lack regenerative capacity. Endothelial wound healing in the defect area is accomplished by cell migration and enlargement. If corneal endothelium cells are reduced, bural keratopathy occurs, and treatment is only corneal transplant surgery. At this conference, Columbia University reported in poster sessions that irradiating corneal endothelium cell with 100 millijoule was not prevalent. So the ocular damage caused by UVC is limited to the cornea because UVC are almost completely absorbed by the cornea. Of course, cornea through the visible light where a lot of animal studies have shown that the corneal epithelium absorb almost all UV, especially UVC. This epithelial UV absorption potentially serve a protective role for the underlying stroma and endothelium, but causes in the process damage and apoptosis, which result in a delayed throttling of the epithelium. The reason photokeratitis is painful is that the epithelium is preferentially damaged and sheds, leaving the underlying subepithelial nerve pressures exposed. An acute injury called UV keratitis or photokeratitis. This is the erosion of the corneal epithelium that causes strong pain, like this yellow. Sometimes young people who perform electrical welding without protective eyewear visit our emergency department in the midnight. And pterygium is a common ocular surface lesion originating in the limbal conjunctiva within the palpebral fissure with progressive involvement of the cornea. UV radiation is believed to play an important role. So avoidance of UV exposure is important to primary prevention. And cataract is a disease in which the lens becomes cloudy and is caused by the degeneration of lens protein. So ophthalmologic assessment can be done in several ways. One is the conjunctival hyperemia. Normally, blood cell can be seen in the conjunctiva. As the conjunctiva becomes hyperemic, the capillaries also dilate. So the degree of hyperemia can be scored as 0, 1, 2, 3. Another way is to check corneal erosions. Corneal ones are stained with fluorescein and excited with blue light to reveal the yellowish-green color of the corneal ones. A score is based on the area and density of the damage. So as observation slit lamp, of course, cataract and pterygium, and facial skin disorder, corneal endothelium cell, and other symptoms. First, we had experiments in the examination room in our ophthalmic ophthalmologic department to confirm long-term safety using care to do. The lamp cycle is 200 seconds on and 1,600 seconds off repeatedly. The lamp was set up to deliver 22 millijoule per 8 hours to the slit lamp. But is it safe or effective to work in this room? So, microorganism inactivation experiment was conducted at night to determine if it's effective. So we use Staphylococcus aureus and phage, and here, this is a slit lamp, and check desk and the foot switch and the control and the paper. As a result of the culture, Staphylococcus and phage were clearly reduced. The efficacy rate is considered to be more than 99%. So the experiments that we conducted in this room involved 6 ophthalmologists. But as you know, myopic is a big problem in Asia. So ophthalmologists also wearing glasses, 4 of 6. So the glasses transmission rate of 222 wavelengths is less than 0.002%. So when wearing glasses, all UVC from the front are cut off and don't reach to the cornea. In this case, UVC irradiates at like this angle. So we conduct the experiments as shown B, like this. So if and this shaded, this line area, UVC does not hit. The cornea is irradiated, but the lower eyelid is not irradiated. Here are the results. 6 ophthalmologists and average age was 39 years old, and there is no ocular disease. They worked average 6.7 hours a week in this room. So corneal erosion score, hyperemia score, and endothelium cell density remained unchanged, and no subjective symptoms. This is the case, no cataract or no pterygium or no erosion. This is before surgery, and this is 12 months later, no change. So from this study, this is a sufficient dose to inactivate the bacteria in examination room, but only the surface. Effect can be seen even with foot switch or desk around the slit lamp, but on the other hand, the effect area is limited because irradiation cannot be applied to the shadow area, like under the keyboard or behind the monitor. So no acute or chronic damage observed for the human eye. Now I also use this room about 10 hours a week, but I have no particular eye pain or symptoms. So eye damage by Far-UVC would be very low, but there is a limitation. The amount of UV exposed in this experiment is actually very, very low, because ophthalmologist sees the desk and to the patient and move to another room and come back to the room. So in next experiments, so high irradiation dose was applied. So how much damage to the eye at high irradiation dose? In these experiments, the irradiation was directed to the eye from under the DB. So yeah, 222 is located in the under TV, and participants watch movie or TV, and we monitor them. They wear special glasses, and the left eye with filter and right eye non-filter. So irradiation condition as follows. So single irradiation and 22 millijoule for one participant, 50 millijoule for two participants, 75 millijoule for two participants. It takes 2 hours for 22 millijoule. So, and we scheduled the eye check, of course, before the radiation and 24 hours later, 1 month, 3 months, and 6 months later. So high radiation is harmful any subjective abnormalities and the difference between animal and humans. So it's difficult to biopsy cornea. So this is visual acuity. It's not problem. And this is a spherical equivalent. This is a test of refraction. And if the thickness of the lens changes due to the degeneration of the lens, maybe myopia will develop. Also, if the cornea is degenerated for some reason like pterygium, the refractive may be changed. But no change. This is the case. There is no hyperemia or other abnormalities and no erosion at 24 hours later. And maybe 24 hours later is the most dangerous, but it's okay. And then no pterygium was observed in the long term after 6 months later. This is 24 hours later, no problem. The injury, there was no difference in corneal and conjunctival scores. Right score minus right score, left score. And during the course of the study, some subjects showed the erosion, minor erosion, but there was no difference between the left and right eyes. One of our friends said he didn't sleep last night and have a video game for a long time. Also, corneal lens stem cell density was not changed. So this is the important subjective symptoms. We found conjunctival hyperemia immediately after irradiation in the 75 millijoule groups. All patients had ocular discomfort and tearing in the only irradiated eye. But these symptoms disappeared within 2 or 4 hours later. So no abnormality was observed, but hyperemia was seen few minutes after irradiation, like this. Only right eye is hyperemia. From this study, UVC irradiation of 22 millijoule or more is no fluorescent staining was observed at 24 hours, suggesting that the cornea had healed with normal turnover. However, the fact that tears were seen for several hours suggests that the minor erosion may have formed on the cornea. But these will return to normal within a few hours. It's a conclusion. Cataract and pterygium don't seem to occur at irradiation dose of 22 millijoule per 8 hours or less. It is also effective for the table or floors.
Extremely long times where there's some repair and recovery. So it was very striking to experience the discomfort at a fairly low dose rate. 10 microwatts per square centimeter was about the lowest we found. And that's still quite a bit above what people would ever be exposed to with current installations. So most people would never experience that. But I got into this because I've always felt that if I'm going to recommend an exposure limit, I should be willing to expose myself, which I did.
Hi, Chris Bowers with Exemer. First, I want to say you did a great job presenting for your first English language presentation. You did a very good job.
Thank you.
I was wondering if you could speculate about. I'm very fascinated by your results with the that glasses decrease the exposure damage. Could you speculate on how contact lenses might impact exposure? I imagine that it's similar, but I'm curious if it's a lot better or if you think it would be not as good as glasses.
Yeah, also contact lens absorb the UV. So I ask the participants don't wearing contact lens and ask to don't go to the mountain or beach or ocean, stay in the home.
Well, thank you.
Thank you.